Good morning, everybody. Thank you so much for coming on this chilly Saturday morning. First of all, I want to introduce Shammy again. She's actually the graduate of the PUMS University. She's going to be graduating June. And she actually just learned on Friday that she matched to specialty. I'm not going to reveal where it was, so you can tell me.
So I just matched in internal medicine at Dignity Health East Valley in Arizona. So.
And we literally learned it on Friday right here in Chicago, so we actually went out to celebrate on Friday night. At any rate, I was born and raised in Poznan, but I did a general surgery residency in the States. And there were times that they had no clue about work hours, so it was really a difficult time, and I know what a residency means. Residency means that you actually reside or live in a hospital, and this is what it was at that time. Now it kind of changed over time, but it was a very long way, but coming back to what President Brugger said, it's definitely worth it. It's definitely worth it to take the long route and help patients and help people. But today I'm just going to talk about our school, and this is, I'm one of the alumni of the school, and Shammy is also a PUMS graduate. So first of all, we're in a public school, so we are almost 100 years old, and we initiated the English-speaking program 30 years ago. It's going to be 30 years ago this year. Currently, we have more than 7,000 students in the school, including 1,000 international students. So some of you may have been into Poznan. This is a beautiful city. It's the 5th biggest city in Poland. It's in the western part of Poland. Is between Warsaw and Berlin. And we currently offer programs in medicine, dentistry, and also a PhD program. So the program in medicine is a 6 years program, which is slightly different in the US. I'm going to go into this later. And the tuition is currently $15,000 per year. The class size is usually no more than 100 students per class, and we obviously eligible for the loan program. So the minimum degree of Bachelor of Sciences in the biomedical field is necessary, and we also offer college courses in biology and organic chemistry. But there's an option to graduate 1 or 1.5 years early, so it's kind of getting towards the US program. So altogether, you're probably not going to do a medical school more than 5 years. And we also offer dentistry, which is 5 years and has a similar tuition. And admissions, we actually open for fall 2023 entry. We have online exam with sessions from biology, chemistry, and physics. And at this point, the eligible students are with high school diploma and courses, prerequisites on high school and college level biology, and at least one of chemistry, physics, or math. And MCAT is optional. So we have huge student community. We have approximately 60 nationality groups, and we are globally recognized by all the agencies and bodies that require this. So we also are made to have an intent to create US physicians. So after medical school, you can go back to the US, and we have very big stats for USMLE, which is the licensing exam that you guys are going to learn throughout the today. And we have one of the highest residency match rates for foreign universities. And one of the things that you have to be aware that it might be slightly more challenging to get back into the US system with the residency, but school is very open to help you out with the electives and whatnot. Okay, those are the sample of US and Canadians residents. You're going to concentrate on Midwest here. So there are several people in the greater Chicago area. And we have already 2,700 of international alumni on all continents and 723 US alumni. So turn to Shammy.
All right. Hi, everyone. So just to talk a little bit more about our student community specifically, just to recap what Professor Gąsiorowski said, so we have a couple different pathways. We do accept students right out of high school for the 6MD program, but for those of you who have an undergraduate degree already, again, you can shorten your studies by up to 1.5 years if you have your undergraduate degree. So a couple different ways you can do this. I went through the graduate pathway because I had my undergraduate already, and so keeping that in mind, I'm going to talk a little bit more about our community. So we have a pretty large American student presence. We have over 100 students just from America alone, though it is international and very diverse. And we have quite a few graduates, about 700 American graduates of the programs combined. If you look at student groups, I think one of the really great things is you have a lot of resources, even though you're in Poland and you're a world away. And for those of you who speak Polish, it will be a much easier transition for you. You do have a lot of communities, including the American Medical Student Association. We have a very active chapter at our school. We also have the North American Student Group chapter, and there are a lot of research associations. So, like Professor said, this is not for the faint of heart. This decision is such an adventure, but you do have to roll up your sleeves and put in a little bit of work. And what's really great about PUMS, and we'll talk about just briefly in a moment, is that if you want to do research, there are plentiful opportunities. If you want hands-on training, there are great opportunities. If you want to scrub in on surgeries in your first year, you can actually do it. You can perform a cardioversion yourself as a student. You can do a bone marrow biopsy. Opportunities that I didn't see afforded to students here in the States. So there are some really great advantages there. When it comes to living on campus, we do have 4 student dormitories available to students that are really reasonably cost. And then they're actually pretty close to most of where your classes are held, so it's a very convenient central location for our students. And of course, whether you're domestically located or you're abroad, medical studies are very difficult and taxing, so we want to make sure you're supported, both in the stress that comes with school and stress that sometimes happens outside of school that we unfortunately face. So for students of both that are English speaking and Polish speaking, you're going to have a student advisor available to you. You'll have psychological counseling services, all free of charge, to make sure that you're supported no matter what troubles you face. So this is a fun little slideshow just to show you a bit of what I did while I was in PUMS just for the first couple of years. And so again, like I said, really, truly, if you want to learn more about something, if you want to spend more time in a certain area, if you want to perform certain procedures, all you have to do, find a professor that you really click with and ask them to come shadow them. And they're so willing and exciting to teach you, to take you on. And your malpractice insurance lets you kind of get your hands dirty pretty quickly. So I think that's a really great opportunity. So Professor Gąsiorowski is pretty modest. In addition to being a thoracic surgeon, a professor, and helping with admissions, he's also the chair of our entire medical simulation program. And our MedSim Center is really, really impressive. We don't have time to show you the video, but there is a promo online, so find it. And you'll get a nice little tour. But we do have high quality, high fidelity mannequins available to help you with some training scenarios, especially high pressure trauma scenarios, so that the first time you're in a stressful scenario is not in the ward with real patients, but you're actually more prepared because you've had some practice. In addition, for those of you who are obviously coming back to the States, we have a Kaplan prep course at the end of our clinical science courses. So after our clinical basic sciences, you have 6 weeks dedicated where you're taught by Kaplan professors, either online or in person. It just depends because COVID kind of changed things. But they send you the full booklets and you go through each study or each subject with the professors as you lead up into the period of time where you would take USMLE Step 1. For those of you who are active like myself, we have fitness facilities right on campus. There are also some private gyms nearby that are really nice. And if you like to play sports, there are university teams. If you're pretty good, you can compete on a national level. Elective clinical rotations, this is something that I think everyone should be aware of. We are a member of the VSLO, so Visiting Student Learning Opportunities, which means that if you have universities here in the US that participate in VSLO, you can complete your electives here through a partnership. We have agreements in place with Florida International University, as well as with some of our alumni across the states, so that's something to keep in mind, because if you're looking for letters of recommendation, which you should before your application, try and make your first 2 electives in the States. Volunteer opportunities are plentiful. Like I mentioned, if you want to do research, you can do it. In the 4 years that I was there and all of the different things I was involved in, I still got like 7 publications, and I'm not an exceptional person. So if you really want to roll up your sleeves, you can make whatever dream come true, regardless of what realm that's in. If you want to do medical missions, they do travel to other countries. I think Guatemala was one. So there are definitely ways to get involved in the community and through the school. Research, like I mentioned, I kind of already said this, and I don't want them to yell at us for going over time. International cooperation, if you wanted to study abroad while studying abroad, we also participate in Erasmus. So you could technically do a semester or a year away at another program and still obtain credits to not set you behind on your timeline. So that's a really cool thing as well. And then, of course, something I have to say, because you have plentiful options for all of you as it stands. If you apply to the United States, one quick distinction, you apply, as you know, in this summer for the following fall. Whereas with Polish universities, you're actually applying same year is potentially an option. So you can apply now through July for this current fall. So for some of you who are kind of in a scenario where you're forced to take a year off, but something that you really want to consider, and one of the great benefits of having a little bit of an extended program, if you do the 5-year program, is you can actually spend that time traveling. So just to brag for funsies, I've been to 11 different countries, and for someone who hadn't been to Europe before, that was a really great opportunity. And that's it. So we'll be around. As I said, we didn't want to talk too long, but come ask us questions. We're friendly and we don't bite, and we're so happy to see you guys here today.